Have you ever been prescribed a medication for something other than what it was originally approved for? This is a really common practice in medicine, and it's called off-label prescribing. Today, let's talk about a fascinating and important example: blood pressure medications. Now, when you hear blood pressure medication, you obviously think of, well, treating high blood pressure or hypertension. And you're right. Drugs like beta blockers, ACE inhibitors, and calcium channel blockers are lifesavers for millions of people managing this condition. They work in different ways to relax blood vessels and reduce the heart's workload, which is fantastic for cardiovascular health. But here's where it gets interesting. Doctors, through years of clinical experience and ongoing research, have discovered these medications can do a lot more. Take beta blockers, for example. Besides lowering blood pressure, they can also calm the body's fight or flight response. This makes them incredibly useful for treating things like performance anxiety. You know, that feeling of a racing heart and trembling hands before a big speech or performance. A low dose of a beta blocker can help manage those physical symptoms, allowing people to perform at their best without the jitters. It doesn't stop there. Beta blockers are also a go-to treatment for preventing migraine headaches. While they might not stop a migraine that's already started, taking them regularly can significantly reduce the frequency and severity of attacks for many sufferers. They're also used to treat certain types of tremors, like essential tremor, by helping to steady the hands. Let's look at another class: alpha blockers. Originally designed for blood pressure, doctors found they also relax the muscles in the prostate and bladder neck. This makes them a first-line treatment for men with an enlarged prostate, a condition called benign prostatic hyperplasia, or BP. It helps improve urine flow and relieves uncomfortable symptoms. They have also been used off-label to help people pass kidney stones and even to treat nightmares associated with PTSD. Another one is clonidine. It's an older blood pressure drug that works on the central nervous system. Because of this unique action, it's now frequently used off-label to help manage ADHD, especially in children who might not respond well to stimulants. It can help with hyperactivity, impulsivity, and even sleep problems. It's also used to ease the difficult symptoms of opioid and alcohol withdrawal. Another commonly used class of medication are Phosphodiesterase type 5 PDE5 inhibitors. You probably know them by their famous brand names. But did you know they were originally developed to treat high blood pressure and angina, which is chest pain caused by reduced blood flow to the heart? During clinical trials, researchers noticed a very unexpected side effect. While they weren't super effective for their original purpose, their ability to improve blood flow in other areas was a game changer. This discovery led to their approval for a completely different condition, erectile dysfunction, and they became some of the most well-known drugs in the world. Of course, I'm talking about Viagra and Cialis, among others. It's a classic example of how scientific observation can lead to incredible breakthroughs. From a heart medication to a lifestyle drug, Phosphodiesterase type 5 PDE5 inhibitors' journey is truly fascinating. Today, they're even used in a different form to treat a serious condition called pulmonary hypertension, a type of high blood pressure that affects the arteries in the lungs. Next, let's talk about a vasodilator called Minoxidil. This is another one that might ring a bell, especially if you've ever looked into hair loss treatments. Originally, Minoxidil was an oral medication used to treat severe high blood pressure. It worked by relaxing blood vessels, which lowered blood pressure. But again, patients and doctors started noticing a peculiar side effect: hair growth. People were sprouting hair in unexpected places. This observation sparked a whole new line of research. Scientists realized that if they could apply Minoxidil directly to the scalp, they might be able to harness this side effect for good, and it worked. They developed a topical solution, and Minoxidil, also known by the brand names Lonatin and Rogaine, became a household name for fighting baldness. They are now one of the most widely used over-the-counter hair growth treatments for both men and women. It's amazing to think that a powerful blood pressure pill ended up on the beauty aisle. So, why does this happen? The official drug approval process is incredibly long and expensive. A pharmaceutical company has to prove a drug is safe and effective for one specific condition to get it approved by regulatory bodies like the FDA. Once it's on the market, doctors can legally prescribe it for any condition they believe it will help, based on scientific evidence and their professional judgment. This flexibility allows medicine to evolve and helps patients get effective treatments faster than if they had to wait for a new approval for every single use. Of course, this is a decision made carefully between you and your doctor. They weigh the potential benefits against any risks and decide if an off-label approach is the right choice for your specific situation. It's a powerful example of how medical knowledge is constantly growing and being applied in new, innovative ways to improve our health and quality of life. So next time you get a prescription, don't be surprised if it's being used for something you didn't expect. It might just be your doctor using a trusted tool in a new and effective way. Thanks so much for watching. If you found this interesting, please give this video a thumbs up and subscribe for more content about health and medicine. See you in the next one.